So again, if you look at a knee replacement, we're going to resurface the end of the femur bone. We're going to, with metal, we're going to replace the top of the tibia bone with metal. There's going to be a plastic bearing, we call it a bearing, but that's the polyethylene that goes between the two pieces of metal, and it's attached to the tibia. And then the back side of this kneecap is going to have a plastic button or a polyethylene button that's going to articulate with the femur here. Again, we don't just cut the bone off, flush at the top and the bottom here. And the knee remains stable because we leave the ligaments on the inside and the outside of the knee intact. So that's what keeps the knee stable, is by keeping your normal ligaments there. So again, the main goals of having a knee replacement is so you have good pain relief and that you restore your motion. If you look at the triathlon knee, and we'll just talk briefly on this, there's all kinds of companies that make knee replacements. They're all a little bit similar, but they have their own differences. And again, why did I pick this company? It partly comes down to what I was trained to do in residency, and partly comes down to some of the research that's been done and the fact of what works good when I use it, and I found that it works real well. And basically, again, it has these different components. This is what the cap that surfaces the end of the femur looks like. This is what the cap that surfaces the tibia bone or the shin bone looks like. This is the plastic component in between, and then that's the plastic component that goes onto the kneecap. If you look at this particular knee and why, again, I like the research behind it, is that it has this single radius of motion, so that as you go through, knee flexion, so you start over on the left, and as you come to the right, as the knee bends, it maintains this arc of motion that's all the same. So it's basically like a ball that's rotating, and so the knee doesn't shift, and it should, again, the studies show it should ultimately improve your range of motion. But we won't get into too many of the technical details of that. But again, in my hands, it works real well, and I've been real happy with patients' results. But it comes down again to this plastic component, or the polyethylene that's between the two pieces. Again, that's where a lot of the research is coming, and all the companies have done a little bit differently to try to make theirs better. Some people put vitamin E in it to try to decrease the amount of free radicals that can cause wear and tear. Anyways, this one that I use, I think that it does a nice job, and it's where the articulation happens. And it's called X3, and the reason that it does well is that the studies show that it has about a 96% decrease in wear compared to other companies. And so I hope that with the patients that I put this knee in, that they're going to get a lot longer wear and tear out of the knee, and it's going to last longer than if I use something else. Again, I will tell you, all the companies do a great job, and they all work well. So if you've had a knee replaced and you have a Zimmer knee or a Biomet knee or a DePuy, those are some of their companies, you'll probably doing real well with your knee, and it should last you, a real long time as well. This is just the one that I chose to use, and again, some of the reasons why I do it. So hopefully, after you have a knee replacement, you're going to have a more natural movement that helps you get back to being yourself. And that's about it.